Hello. Sorry, everybody. I am using my phone today and I'm trying to make sure that I can see you. Rotation is locked. Orient device back. Okay, yay, I'm live. I'm live. Hello, everyone. I'm on my laptop today, but we're doing Dentist Live a little early today. So I hope that everyone can hear me just fine. Please excuse me while I try to reorient. Oh no. How I try to reorient my screen so that it doesn't do some weird things. I wasn't planning on recording in landscape. I was planning on recording. Sorry about that. Yay, we're here. We're here. Alrighty. Hello, everyone. Please make sure that you say hello so that I can say, hi, Golden Goods. Hi, how are you? I know that it's a lot different of a time frame than what we normally do, which is around, hi, Jonathan, late in the day. Hi, Gal for God. Hi, Mitch. Anyone else? Roll call. Hi, Adir. I was actually going to start with your question first before anybody. Anybody else coming on? Okay, so I know that normally I do this later. I'm hoping that, hi Rosalie. I'm hoping that this is a good time. It just turns out that in my schedule, it turned out that this is, I have the time to do right now. So we're gonna do that. Now, I promised Adir that we were gonna have, yay, I know because it's not the middle of the night. I promised Adir that the first question that we were gonna ask starting off right away is a question on sinus lift. So forgive me, I had my phone all set up the right way, the way that I wanted to do, because I want to draw something on here today to do a little explanation, but then got me locked in landscape, so I don't wanna mess with it. All right, so we're gonna start, maybe I'll pull it back a little. So we're gonna start by doing a little drawing today. You know, if you've ever been on this live before, you know how much I love to have drawings and demonstrations and stuff like that. So the first thing we're going to talk about is sinus lift. Sinus lift is not something that most people talk about unless they go to do a dental implant. And when they go to do a dental implant, their dentist says they need a sinus lift. So I'm going to explain that to you. The picture that I posted from my post was one of these guys here. Okay, one of these guys here. And the reason that I posted this picture is because in order to talk about sinus lift, and I actually plan to do an anatomy lesson with this guy. This is actually real, by the way. Anatomy lesson with this guy is it will show you some of the anatomy and what that means. Now, a sinus lift simply means there are empty air pockets in our faces. And if you want to do a dental implant and the dental implant is possibly going to sit in those spaces, it's really important for us to create bone in those areas. So I'm going to do a quick little diagram. So a lot of times, especially in the times where it gets a little colder, and yes, I'm in South Florida, but it does get cold. Like now it's a little chilly, a little. Yesterday is a little bit more chilly. Probably like 50 degrees is like really cold for us. But I'm going to draw a quick little demonstration. So let's say, for example, you have a tooth or teeth. Usually it's a molar tooth, and I'm going to do my best drawing here. Okay. And this is another molar tooth, okay? And let's say you have another, we say like a premolar tooth, which is like one of those smaller teeth, right? So on the top, this is a horrible drawing. On the top of your mouth, right in here, you have your sinus. Now, in the front, so let's say this is the front of your mouth. Hi, Christina. This is the front of your mouth and this is the back of your mouth. So your sinus will kind of do something like this. So that empty air pockets that sits in your face on the side, it sits like this. Now what is in here is nothing but air, okay? There's some bone depending, this is a 2D image, meaning you can see this way and this way, but you can't see. Hi, John Brown. Yes, I remember you from last week. So you see, this is air pockets. So sometimes when a dentist says that they want to do a sinus lift, sometimes, let's say, for example, you lost this tooth, and you want to put an implant here. If we want to put an implant in here and there's only this much bone, we don't have enough bone to actually place an implant. Let's say this is only, and I'm getting very technical, this is only 2 millimeters long, but we need like at least 10. So we can't put the implant in here into the socket with all of here sticking into nothing. So what we do is we do a procedure that is called a sinus lift, with basically we bump this bone. This is bone and this is bone, and in between is bone. We bump this bone up, 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 so that we have more space to do an implant. Oh, that looks horrible. Okay, does that make sense? All right, so one more time. This is our sinus. Now, this is also important because sometimes people will have pain in their face and they will think they have a tooth problem, when sometimes what they really have is a sinus infection, or sometimes they will actually have just sinus pressure from the change in the weather. I don't know, I never practice in New York or someplace that gets cold all the time, but yes, here in Florida, sometimes when the weather changes, I'll have people come in and do I have to add bone? Yes. And I'm going to answer that just a little bit, Mitch. So the reason that happens a lot is when people have sinus pressure and then they have a molar that's sitting in their sinuses, all of a sudden, John Brown, please remind me what video I'm supposed to make for you. Hi, Hanka. Hi. I'm not sure if I've seen that name, looks familiar, but hello. So if we have this situation, right? And I said I was going to do it again. A lot of times people will mistaken what they feel with their sinuses with what is actually going on, which is because of this sinus pressure, it pushes down on the teeth and it causes their teeth to hurt. Usually people who have a sinus infection or something like that, who will mistake it for a toothache, will say a whole section of their mouth hurts, like a whole section of teeth, because all the other teeth will sit there. This is not true. This is not true of the bottom teeth. This is only true of the top teeth, not true of the bottom teeth at all. The bottom teeth do not have the sinuses. The same, so I talked up. Oh, you asked for, John, I remember, you asked for a video showing the things that I do for my own mouth, which I am in process of making. So someone asked me, Mitch asked me, so do you have to add bone? Yes, you have to add bone, because this little in-between part of where the root is sitting, this part is bone in between here and here. And in order for us to push this part up, 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 so that it goes taller, so we have more room for the implant, in order for us to push it up, what we have to do is add bone here, and the bone that we're adding, like push, 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 up, 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 until we have more. So then what we end up having is, sorry, this is not a good illustration, but we end up having more area like this, filled with bone, that now we can put an implant inside of. There's a lot of different ways that we can do that. And Nadir asked this question, I'm assuming because maybe you heard the word sinus lift before. There's two ways. Something is called a crestal approach, which means we go through the tooth that you just had taken out. We go through the top of it. And then we have a lateral window approach, which means instead of us doing a through the socket, we go through the side. So we go through the side, we see where the sinus is, through the side, and then we lift it up, but through the side, not through the inside of the tooth where the tooth came out. So I hope that explained sinus lift. It's not a very, it's not something that we do all the time. We do it in the cases that we feel like we need more bone. Oftentimes I tell people, I have done a sinus lift there. I do crestal approach, which is minimally invasive, means I place bone inside of the socket. Okay, so another way that I want to describe this is really important when it comes to sinus lift, is imagine your sinus like a balloon filled with air, not with water or anything like that. A balloon filled with air. When we're going to push that up, we don't want to pop the balloon. If we pop the balloon, we're in the air. But we want to just kind of push it up a little bit. So the sinus is a membrane. If your sinus is perforated, that's what we say. If your sinus is perforated, meaning we make a hole in your sinus, then it's hard to do a sinus lift because we pop the balloon and all we want to do is bump it up just a little bit. So when I do an implant, if I think, or even an extraction, if I think that I might have been in the sinus on accident, what I have people do is they hold their nose and they blow down really hard. And if air comes out of the hole that I just made, the tooth that I just pulled, I know I have a sinus communication. Now, it's not anything to scream about. All you do is you wait for it to heal. The body will put the balloon back together. There's nothing special for a procedure for you to do. Now, you don't want to put things in the sinus, but at the same time, the sinus will heal itself. And I basically tell people no bearing down. So any aggressive sneezing or pushing through your nose or bearing down, that's going to blow that membrane back open again. So basically not any hard blowing. That's enough. That's enough to fix the sinus. If you ever had something to drink and something burned in your nose, that's because the liquid that you were drinking went through the wrong pathway and got into your sinus and burned in here. That your nasal sinuses are a lot easier to get into than even your other sinuses. So in that case, like what we're really doing is we're really just trying to make sure that the implant has enough bone around it so that it can heal properly. And implants do not osteointegrate into air. Okay, now another question that Adir had asked that I want to make sure that I address is something when it pertains to high smile. High smile is just basically hi, Hakan. I want to make sure I'm saying that right. Adir. So high smile is basically just another one of those will a silver tooth hurt? Can you ask me AK47 Rain? Can you ask me that in a different way so I can understand the question better? So High Smile is basically a whitening agent that's very popular. I see all kinds of whitening, glow, all of that stuff, marketing on the market. Most of them are about the same. I know that a lot of celebrities, I've seen either Floyd Mayweather and other famous people kind of repping teeth whitening. Teeth whitening is great. Teeth whitening is experimental. And I've said this like a million times. Everything with teeth whitening is experimenting, meaning how it works on me and how it works on somebody else is going to be totally different. So you want to, if I get a silver teeth transplant, I'm not sure I understand what that question is, but I'm going to answer it anyways. So when you do whitening, the one that you choose is really up to you. I say choose a whitening that fits your budget and see if it works. If it's not working, try something else. Maybe try a professional whitening at a dental office, but it's gonna be an experiment. Some people get amazing whitening results with hydrogen peroxide. Hydrogen peroxide costs $1.29 at the store. I use hydrogen peroxide on a regular basis. Most days, John Brown asked me that. I use hydrogen peroxide a lot. And that's just because I like it, right? And I feel like I get whitening. I use charcoal a lot. I've recently started oil pulling a lot more, which also whitens your teeth. So all of those things, I always start with the simplest thing. After you do the simplest, my research on High Smile says it's about $60. That's reasonable compared to a couple $100 that it will cost you at a dental office. So if you feel like that is good for you and it's working for you, then use it. I've had people use Crest white strips, and I said this in my video, and get amazing results. And I've had people use Crest white strip and get 0 results. So you have to try. Crest white strips will cost you about $40, sometimes $25, and sometimes $60, depending on how many different kinds that they have available. So whatever it is, what you're doing is you're using it as an experiment to find out what is the best thing that works for you. But more than anything, just like exercise, just like doing anything positive, you have to stay consistent. Sorry, I just heard a weird noise. You have to stay consistent. If you use it one day and it doesn't give you 10 shades in one day, you can't say it doesn't work. You have to use it the whole time. So if your Crest white strips is 10 days, use it for 10 days so you can see if it's legit. And if you can, you always have to do maintenance. If you're not doing maintenance on your whitening, your teeth are going to stain again. Unless you plan to keep your mouth open and never do another thing, eat another thing, drink another coffee, have another tea, have another glass of wine, eat any spaghetti ever in your whole life, your teeth will continue to stain. Now, somebody was asking about silver fillings. Silver fillings, I don't understand the question that well, but I will answer it in the way that I understand. There's 2 types of silver that are in people's mouths. Number 1, silver caps. Usually you'll see a silver cap on a child. The reason we do silver caps on a child is because you're growing, and growing children, we don't do permanent rigid crowns because they're gonna grow. And when they grow, there might be gaps and spaces that we didn't have. There might be new things that we didn't see before. So most of the kids, when they get a silver cap on their tooth, when they get a silver cap on their tooth, we're expecting that when they turn 18 or when they get older, that they need to change that silver cap out for an adult crown. Now, a lot of people forget because they're a kid. Maybe their parents were taking care of it and they weren't. But usually if we're doing a silver cap on a child, it's because they have a really big cavity, a really bad cavity that cannot just get a filling. So it's really important to go back later when they turn into adults and replace that silver cap, or that we call it a stainless steel crown, with a regular crown. If not, what's going to happen is it's going to decay underneath because it's not custom made to the tooth. There's literally a tray of teeth, and there's different sizes. Just to be easy, I'll say small, medium, large. So there are different shapes and sizes, and the dentist will pick out the crown that they feel is the best one, crimp it onto the child's tooth. The other kind of silver that's in the mouth is a silver filling. Now, I don't know if you meant that either, but a silver filling is just, I mean, silver fillings have dropped in popularity pretty dramatically. So a lot of people do not get any silver fillings anymore. But at the same time, at least, they last a long time. And they last a long time, but the negative is usually when a silver filling is done, the tooth ends up breaking and you end up needing a crown. So benefit, you have it for a really long time, but when it goes, usually it takes the tooth with it. I can't tell you how many times I see somebody with half of their tooth missing, and it's really because the silver filling is like a wedge. So imagine this is your tooth, and you put something in the middle, and every time you eat, you bite, and you're hammering it until one day it just pops apart. Now, when it pops apart, sometimes it pops apart and you still have tooth left, and sometimes it pops apart and splits your tooth straight down the middle. We don't know how that's gonna happen. So usually I just had a patient the other day. I've been telling her forever. I'm like, listen, you have this big silver filling, you really need to change it with the crown. Then what happens? Usually what happens is the most inconvenient time of your life, that's when that thing breaks. You're eating the softest of things. It's not even anything hard. I saw a patient this morning. She broke her tooth on spaghetti. Spaghetti. People break their teeth on donuts, spaghetti, soup, bagels, oatmeal. Oh, well, no, not bagels. Bagels are a little tougher. Oatmeal, like it's salad. Like your tooth is not breaking because you had salad. Your tooth is breaking because something is inherently wrong. And that thing is the proverbial straw that broke the camel's back. So that's it. So those are my questions. Wow, I went through that really, really quick. Does anybody else have any other questions? Don't do that to me. Oh, sorry. This thing is pausing on me, asking me all kinds of Apple questions. I was trying to see if there's anything else that I kind of wanted to address. I do like the idea, and that comes from Adir's question about sinus lift, about how people get confused about sometimes something medically is going on with them and they think it's the tooth, or vice versa. So a lot of times, I told you the sinus lift, that more goes with upper teeth. But a lot of times people come in and they have a terrible earache. Anybody who's come in, make sure you say hello. They have a terrible earache and they swear up and down they have an ear infection, and they don't have an ear infection. They in fact have a toothache. Now, pain to your ear does not come from top teeth. So usually, like a lot of times I'll have people who come in and they'll be like, I really don't know where my pain is coming from. If you don't know where your pain is coming from and you say, I have pain to my ear, there is a high likelihood, hi Mitham, how are you? There's a huge likelihood that your pain is coming from the bottom. Now, if you have pain straight through your eye, it's unlikely that the pain is coming from the bottom. The pain is coming from the top. I do have an old video. I wasn't even living in this house at the time. And it is about what my pain means. So, I call myself a dental investigator. A lot of times people come in, they're kind of confused. They've been in pain for a little while. And the longer you're in pain, the more confusing the pain will get. So if you have a pain on the top, you think it's this one, but man, now it feels on the top. Now I feel it on the bottom. Oh my goodness. They start to get so confused. I say usually your first instinct is the right one. So the one that you felt the first time, that's that. And then it starts to refer. Can it refer to the back? Yes. Refer to the front, refer to the top, even though those nerves and our nerves in general are in different quadrants. So about 4 quadrants, upper right, upper left, lower right, lower left. So they're about in different quadrants, but it is very, very likely that sometimes pain starts to radiate. And it's there so long, you just feel so bad and so uncomfortable. You're like, you know what, doc, I don't even know where this pain is coming from anymore. It just hurts. So in that case, I help you as a dental investigator, to help you to kind of figure out where is this pain coming from, and like what is the true nature of it. And that's why I ask, does it hurt with hot? Does it hurt with cold? Does it hurt with bite? Well, do you think, oh, I can. Okay. What thing underneath your tongue, by the way? There's a lot of things underneath your tongue. So hot, cold, sweet, All of those things are connected to something. All of those sensations that you have. Sweet typically means you have a cavity. Biting typically means you have a crack. If you have pain to your ear, usually means the bottom tooth. Pain to your eye means the top tooth. If it only hurts with hot but not with cold, that has different meanings. Pain that wakes you up at night, that typically means you need a root canal. So sometimes people will get a little frustrated with me because I ask them a million questions, but I'm asking those questions because those questions, even if nothing is on the x-ray, they mean something. Forgive me while I drink a lot of water because I've been talking a lot today. Now, what is under your tongue? I have an anatomy lesson coming your way soon. I filmed the video, but I'm definitely going to be doing, and I have my little guy here. He does have an unhingeable jaw, meaning unhingeable. Am I saying that right? That means I can take his lower jaw off. Okay. And I think Mitch or somebody asked me about bone loss and alveoloplasty on a previous thing. But okay, so here's the lower jaw. Okay. Right? There's a lot of different structures, but obviously you're probably talking about a soft tissue structure. And in the mouth, underneath the tongue, there is, okay, I'm not sure if I talked about this in my ortho video, but if you, and I'm sorry, I'm gonna do it like this. If you lift your lip up, there's a little string in between here. We call that string, that muscle, we call it a frenum. And a frenum is basically a muscular attachment. Now, there's also a muscular attachment underneath your tongue. So underneath your tongue, it links from your tongue and it attaches to something we call a geniotubercle. Do you see this little thing right here? That little thing, this little bump, and your tongue attached in that inside place. Now, if you've ever heard the term tongue-tied, that comes from when that attachment is too tight, and some people, they can't even stick their tongue out. That's how tight that thing is. For babies, they will cut it so they can untongue-tie them so that they can speak and learn to speak properly. Supposedly, it's a very painless procedure. If you look it up, I'm sure you'll find tons of videos of little babies who cannot suck, who cannot nurse, who cannot suck on a bottle because they're tongue-tied. So they cut that little thing. An oral surgeon typically does that and cuts that little thing. So if that's what you mean, what's underneath your tongue, that is your lingual frenum. In the top, we call it a labial or a buccal frenum, which is the muscle that goes. That muscle there is responsible for why people have gaps. The reason that people have gaps is because that frenum is very heavy. I tell you guys all the videos I'm working on and the things that are coming up. I have a video that I'm going to be working on coming up really soon called I Love My Gap, because there's a lot of people who love their gaps and there is really no clinical reason that we have to close your gaps. So we close your gaps because you want it. But I have a lot of people, especially from the islands, who love their gap. They love to see their gap. They think their gap is sexy. They think their gap means that all of these attractive things. My assistant said she married her. She was attracted to her husband because he has a gap. So lots of people love their gap. I met a little girl. She's 15 years old and she wants to get clear aligners, but she said she doesn't want to close her gap. So there's a lot of people who love their gap. So that's not something that, you know, people say all the time, oh, do I need braces? Like, what do you like about yourself? You know, there's some people that's their signature for their family. So they're not going to get rid of it. So all of those things. Adir, did I answer your question properly about what's underneath your tongue? So Fuji fillings. I apologize, everybody else. So that's about with the gap. So Fuji fillings, I don't know what a Fuji filling is. I know what Fuji is, but Fuji is a name brand. Because you have to even remember, like, from the inside, as a dentist, we not only have composite, we have composite brands. So we know all that. It's the same thing that I tell people all the time about clear aligners. Smile Direct Club is a brand of clear aligners. ClearCorrect is a brand of clear aligners. Invisalign is a brand. They all do the same thing for the most part. So even when we're talking about the whitening, the whitening High Smile is a branding. Oh, yes. That is the question that you asked. Is the international system suitable for, and please forgive me, I can't. I think I think what you're saying is, Okay, sorry. I was trying to read the question at the same time. I wish that when I was on my phone, I could pull everything back up, the questions. But I think the question is, there's different numbering systems for tooth extractions. There's different numbering systems for identifying the tooth numbers. And I have a video about tooth numbers and counting your teeth numbers. And for the most part, teeth numbers are really... like the United States has a version, a universal, we say universal, obviously, because we think we know everything. And then different countries or internationally, there's another one. So when I do an extraction that came from another office, I always make sure that I am knowing from the dentist what system that they were using when they decided to call that. So for example, tooth number 11 can... Oh, the clotting number. I thought you said for extractions, I'm sorry. That is the question that I was supposed to look at. What is the normal INR? And for people who don't know an INR, there's basically a clotting number. I'm sorry. I'm going to have to get back to you on that one. I forgot. I knew there was a question, but I'm not sure if you posted it in the comments of the number. Basically, the numbers that we use to make sure that it is safe for you to have your teeth extracted, especially people who are on blood thinners and take aspirin, baby aspirin every day. I won't lie, and you can say whatever you want. I don't make a big deal about those numbers. The reality is, if you are doing dentistry in a safe way, unless somebody has a hemophilia or some sort of condition that makes them bleed excessively, I don't worry about blood thinners when it comes to surgery. I do send letters to the cardiologist. I let them worry about those numbers and if they feel their patient is stable or not. So INR, or even like in diabetes, like all of the HbC ones, 1C, I'm saying everything so fast. The numbers that they use to see over a 3-month period, if they're holding too much, hi Elizabeth, if they're holding too much sugar in their blood, all of those things, I let the medical doctor, I'm not your medical doctor. However, I defer to them. So I will write down, hi Maurice, I will write to them and I will say, this is the procedure that I wish to do. These are the medications that I wish to prescribe. These are the things that I'm going to do, like injection wise and stuff like that. Is it safe for me to do so? And I let the cardiologist determine that. I let the general physician determine that. I do not mess a lot with INR numbers. That's why that is something we learned once upon a time, but it's not something that I'm constantly, oh, what's your INR? Listen, I live in a real world and practical world, and the practical world that I live in says that if I am not going to do something that is going to cut a blood vessel, I don't need to worry about bleeding, and I never want to take anybody off of the medication that they use to keep their heart working well and to get no blood clots and stuff like that. So if we can do something local that doesn't disrupt everything, that's how I'm going to keep it. I'm going to keep it simple, 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 simple. So yes, I could leave in the comments once I look up what a appropriate INR to do an extraction, but there's not a lot that defers me unless I feel like you are too compromised. And in that case, I wouldn't even treatment plan you. Like if I have somebody that I feel like has too many medical conditions to be able to endure the treatment that I have, I'm not going to do that to you. Like I have people who come in and they're in their 90s. Why am I going to treatment plan 10 crowns on somebody who's 90 years old? Like they have a different, I had a patient come in last week and she has some teeth that move a little bit. She doesn't have an abscess, she doesn't have an infection, but her tooth moves. I said, listen, we're gonna watch you. You need to come on a regular basis. We need to make sure that you're okay. But everybody, there's nothing about the way that I practice dentistry that is cookie cutter. I don't make it that for everybody, this is the way we treat you, because I am talking to every individual person to find out what is going to work for you in particular. So with numbers like that, I'm making sure that I am super cautious, because you have to be with some people who are medically compromised. And I know you're asking that from a dental perspective, but the reality is that we're not their physician. Their physician has all of their numbers, their labs, because if you start reading them, then you're responsible for them. Do you know? If you start reading them, then you become responsible to tell them what they mean. Any other questions? You know, I'll start wrapping this thing up. What else did I want to talk about that happened this week. I do actually have some more ASMR videos coming out soon. I know that that was one of the requests that I had, but I'm excited to do those. I think those are fun. I was watching my daughter. Now, anybody who doesn't have a question, you can stop listening to me because now I'm just gonna blab. But I was, my daughter last night, we were sitting on the couch. Yes, Mitch, I just said I have an ASMR video, which is going to be a drilling one, which is, I think, the one that you had requested. I did have, oh, somebody asked me about bibs, like the bib clip. I forgot who asked me about putting on the, now this one is going to be mostly drilling. Elizabeth, if you have any ASMR videos in particular that you want to see, please let me know. But this one is going to be a drilling one, which I actually enjoyed. I actually enjoyed that. I don't know. I enjoy them as much, listening to them as much as I enjoy making them. It's interesting once you start doing that and I start to tell the story of my daughter. My daughter loves to watch these oddly satisfying videos. And until Adir said something, I really was not even thinking about that at all. And then she was watching last night someone who was just cutting kinetic sand. If you know what kinetic sand is, kind of like, and it was in all colors. They're just slicing it, slicing it, and slicing it over and over again. And it's so mesmerizing to watch somebody slice kinetic sand over and over again. It's bizarre, but I can see how soothing it might be. Even me, myself, every night I go to sleep listening to something called Good Vibes, which is certain frequencies of sounds. And so they have different frequencies of sound, and they'll say, oh, this is clear your chakras, or they'll come up with different names, but they all sound about the same. But I enjoy all of them. So I understand that. And, you know, for me, the reason I even like the ASMR videos is because I really want anything, even though it's odd, anything that's gonna make you feel just a little less like anxious, you know, just a little less anxious. Because I cannot, when I do dental work for someone, I'm pretty confident that at the end of it, you could at least say, hey, that wasn't as bad as I thought, right? I feel good about that. That's my goal, to make that, oh, you are the one who wants a bib ASMR. So if you don't want the drilling ASMR, gotta wait a little bit more. Maybe I'll make that fun for you sooner than later. I might have to make the ASMR videos on a shorter schedule than I make the other videos because they take me much more time. But those take me not that. I mean, you're basically on a loop of listening to it. But yeah, so anything that I can do to make, sorry, chuckling back. Anything that I can do to make that appointment not so scary, not so thing. So if it's a soothing relaxation sound, repetitive, redundant, that makes you feel like the dental drill is not scary, or the dental drill is not quite like putting your skin on edge, is good. If I could make something, hi kings and queens, if I could make something that literally you could watch somebody get an injection 10 times, I would do it. If I had to give injections to myself to make you guys know, stop being so afraid of the dental needle. Literally, it is the shortest part of your whole procedure, getting tooth anesthesia. I would, because people build up that portion so much. Listen, I am an honest dentist, and I will tell you, it doesn't feel good. It doesn't feel good for somebody to stick a needle in your mouth. It's not natural and it doesn't feel good. I have no delusions about that. But, and when I say this next part, don't be offended. It's not that bad, okay? So when I say it's not that bad, it's because the way that everybody builds it up so large in their mind that this needle that I'm gonna stick inside of you is going to kill you. It's not gonna kill you. It's gonna pierce your skin. It's gonna push some things. It doesn't feel good. It doesn't feel good. Oh yes, you told me you play the tuba. And that's why you missed the lives. You see, I did this early just for you. Okay, what can I do? And I think that was Rock Simmer who says that they dread the dental needle. Now, you know, I'm done answering questions or whatever, so I'm just a little bit more relaxed, and I'm just gonna like say this. Let's have a conversation. What can a dentist do? And everybody who's on this live, what can a dentist do? Mitch says, how often do I go to the dentist? I'll answer that in a little bit. Every day. I go to the dentist every day. I am the dentist. What can a dentist do to make you feel better about this needle? Any suggestions? I would love to hear all of them. So if anybody wants to answer that question, what can a dentist do to make you, because I can tell you what I'm gonna do. I'm gonna hide it from you. I hold, like literally I stand with my hands behind my back and I have the syringe in my hand and I'm holding it. Sometimes I'm holding it for 20 minutes. People don't even know I'm holding it. That's the way I was taught. We never show it. When I give anesthesia, I come from the bottom So if you're in the chair, you don't see it. I come from down here. I'm not coming like, so you're gonna scream. I come from the bottom so that you don't see, because most people, they're looking up, they can't see. Unless they're looking for the needle, they're not gonna be able to see it. So it's never in your line of sight if it's up to me. Some people, they go say, ooh, what's behind your back? Don't worry about that. Don't worry about that, I got you. You understand what I mean? So I know the things. I'm going to wiggle your lip, and I think I talked about a lot of these things. I'm going to do my part. I'm going to place topical. I'm going to talk to you. I'm going to try to see if I can make you feel better. But what can the dentist do? What can the dentist do to get rid of some of that fear and anxiety? Do you need to get desensitized by seeing it happen over and over again? And if you see it happen over and over again, you're going to be like, okay, or is that going to freak you out? Because when I did that needles video, I was like, oh my gosh, these people are going to be completely freaked out by the fact that I'm showing this syringe. But I'm trying to desensitize it and demystify it so that it wouldn't. Oh, thank you, Adir. That is so sweet. That is so sweet. What is my technique to deal with pediatric patients? I need to answer that, but I also want to answer, how often do I go to the dentist? I get my cleaning every 6 months. I try to do it a little bit more often than I can. I do trust my hygienist. I ask them if I have any cavities. I take x-rays. I analyze my own x-rays. If I need dental work done, I have a really good friend in like an hour away from me, north, 30 minutes, 45 minutes, I don't know. And I go to see her if I need to. If anything I need to do, I just do it myself. But for the most part, I'm pretty obsessive with my mouth because I love to eat and I don't want any apprehensions, and I don't want to only eat on my right side or only eat on my left side. I want to have full thing. I love to eat. I love sweet foods. I eat candy like a lot. I love sweets. I love candy. I love all of the things that you shouldn't love. I love them. So I'm a real person. You know, I've had dental you love sweets too? Me too. Somebody asked me about, so yes, I take care of my teeth. I floss, I brush. I try to do as many things as I can because it's hard for me and I don't have time for sitting in the dental chair. It's very difficult for me. I wanted to say about techniques for taking care of children. Children are very tricky. When a child goes to a dental office for a pediatric, they're not going because that other dentist knows how to do something special. We have no offense to pediatric dentists, they're freaking amazing, they're amazing, but they're going there because they have adjunctive things that they do to calm the kid, to make an environment that they want to be at the dental office. For example, we have a dental office in our area. It's called Minnie Mouths, and literally it's all Disney. Like the whole office is like Minnie Mouths, and it looks like two little M's with two little Mickey and Minnie Mouse on there, and it's all about that. I have another orthodontic office that also has some sort of pediatric portion because ortho is mostly kids, and they have giant fish tank. In fact, I think that they were on this show for fish tanks, fancy fish tanks. He has a shark that hangs over. Is Dr. Larry Kawa, who is in Boca Raton, and shout out to him. But it's like one of those things that, like, you do all of these things simply to make the kid feel comfortable. I saw a 3-year-old yesterday, and she was adorable. She opened with no problem. I said, open big like an alligator. We give them stickers. We give them little biting teeth that run around. We try to make it fun. We don't push x-rays on the child because x-rays really for a child, unless they have problems, is really unnecessary. So, we're pushing oral hygiene, but we want to make that appointment as relaxed as possible. I read something because I was doing all my C courses for my license renewal, because this is a year for that, and we're talking about the apprehensive patient, and they were saying that most people develop traumas for dentistry right around the age 7 through 9. So now that's around this time. Now imagine somebody who's 40 years old who's deathly afraid of the dentist. They probably didn't have an experience at 25, even though that happens, okay? I'm not saying it doesn't happen, but a lot of their experiences literally come from childhood experiences that traumatize them. So for me, even if I can do the work, I want them to, I want them to have a positive experience, because if they have a positive experience, they're not going to go and for the rest of their lives be traumatized by something that I did. And now they don't go to the dentist. They have abscesses and infections and all kinds of things that they're not going to take care of because they're afraid of the dentist for something that happened 25 years ago, something that happened 30 years ago. So it's really, really important. I take huge responsibility for that so I don't scare people. With an adult, you can talk to them and you can say, this is good for you and this is why and blah, blah, blah. And I know it hurts, but you just have to go for a little bit. Kids don't care about that. Kids don't care about that. Kids are like, this is horrible and I want to go home. And sometimes they won't even open their mouth to you. And I don't believe in all of those scary tactics that they used to have once upon a time. They used to have papoose, which is basically a straitjacket. It's basically a straitjacket. I don't know how much they use a papoose in dentistry and pediatric dentistry as like they used to. But that, I mean, a kid, you know, you drill on a kid and it's hurting and you keep going, that kid is going to remember that thing for the rest of their life, and they don't understand the circumstance. They don't understand why their parent did it. They're going to hate the dentist. That's it. They're going to hate the dentist, and there is very little I can do about it until they have something that is really wrong with them. And then at the end of that, they're going to be like, oh, okay. Yeah, it is scary. Oh, are you kidding me? I can tell you so many stories of dentists who basically have gotten on top of people in the chair, lean on top of them. You know, like they do things that I'm like, oh my God, you do something like this to someone, they're never gonna go to the dentist ever again. Oh my God. Like I cringe sometimes too when I hear these stories because I feel bad and I feel like why? You know, I'm not a perfect person. I'm not a perfect dentist, and I'm not saying everybody doesn't have an inch of pain. I'm very, yes, that is so true. You know, I don't take any, you know, I don't take any of it for granted, and I don't take for granted that most people coming to me do not want to be there. And what you said is so true. If you hate the dentist, you have to go more. If you hate the dentist, the children have... Yes, oh, I have to say that. I have to respond to that. If you hate the dentist, you have to go more, because the longer you stay away from the dentist, the more work you're going to have to do. You know, damned if you do, damned if you don't. If you don't go to the dentist, now your filling that could have been a filling is now a root canal. Now that tooth needs to be extracted and you need an implant. Now you're in excruciating pain on the weekend, and now it takes more anesthesia to numb you because you waited a long time. So the more that you do, I do fillings without anesthesia all the time. And that's because they're small. Those are the people who come on a regular basis, and the people who like wait many, many years. Now there's people, they don't do anything they're supposed to. They don't come when they're supposed to. They have no cavities when they're done. But if you're somebody who's prone to cavities and gets cavities all the time and has had a history of it, you know, like why would you take the risk to stay away longer? Because when you see that dentist again, they're not going to have anything nice to say except that you need a ton of work. Somebody made a comment about how much time it takes to treat a child. And it's true. It takes so much negotiation. I'll be in there with the parent, and the parent is saying, I'm going to buy you an LOL. I have a kid. I have kids that love LOLs. If anybody knows what LOL is, I'll buy you an LOL. I take you for ice cream. I'll buy you this. I'll have this and that. Maurice, I'll answer that question in just a second. And all that negotiation, and then nobody knows. Maurice wants to know, do I have crowns or bridge? I have implants. I don't have any regular crowns, but I have 2 implants on my lower left and 1 implant on my lower right. And the reason I have those implants, and I tell my patients all the time, do not take clenching and grinding. You better take that seriously because it will take your teeth. I am not somebody who's cavity prone. I have had a couple of fillings in my life and I've had them filled, but I'm not getting cavities all the time. I take good care of my teeth. However, the problems that I've had is simply because that's what I'm doing when I'm sleeping. I'm either clenching or grinding the heck out of my teeth. And when you do that, you're putting pressure. I told this patient the other day, and people don't understand when I say this, when you clench and grind your teeth, you're doing something your teeth never do. When you eat, your teeth do not touch. Your teeth don't touch. They touch for a millisecond. When you speak, your teeth do not touch. Think about it. Your teeth don't touch. So if you start, you're going to break stuff. You're going to break stuff. And then you're either end up needing crowns or implants and stuff like that. How long does it take to do a root canal? It depends. I am relatively fast. I'm going to say that very slow because I have to say I am relatively fast because I work in a solo practice. I do have associates who work for me, and those associates They do things on a different time than me. Now, if my assistant who's worked for other people says, "Ooh, Dr. Denis, you're very fast," I have to take her word for it. I'm not timing other people. I only time myself. If for me to do a root canal on a molar, okay, right? So front tooth is different than a middle tooth, which is a premolar, and a molar tooth, which is a big tooth in the back. A molar takes the longest. A front tooth takes a little shorter. There are variables in that because some people are much more complicated. And remember, the time that it takes a dentist to do a procedure is not only because of the dentist's skill. There's also people who make it much more difficult. I'm not blaming them, but some people, I'm gonna answer that too. There's some people that they're coughing, they gag, they're scared, they need a pep talk, they need a moment, they gotta go to the bathroom, they don't feel okay, oh, I'm not numb. So there's a human component to that of how long it takes to do stuff. You know, so like for me, typically it's about an hour and a half, probably maybe 2 hours, depending on what else is going on in the office. If I'm seeing them by themselves, it takes a lot. How long will it last? Oh, I went into this whole dissertation. That's not even what you were asking me. And by the way, the other person who asked, no, I've never had braces. I've never had braces. I do sometimes want to close this little gap that's on the side here, but I don't want it to mess up my bite. But I've never had braces because I was born to be a dentist. That's my joke. I don't know. I was born, and then people say people with the last name D are more likely to be dentists, but the reality is that's my married name. So I can't take credit for it. How long does it last? A root canal, a good root canal should last you for the rest of your life. That's not a good answer because most people's root canals do not last for the rest of their life. But the reason that I cannot answer that question well, okay, if you ask dental insurance, how long, you get braces tomorrow, congratulations. Make sure to let us know how it goes. Make sure you're cleaning your teeth on a regular basis and get all the ortho flossers and stuff like that. I have a lot of tips on how to make sure you keep those braces clean because you don't want to have problems after. But the reason that I can't tell you how the reason that I can't tell you how long a root canal will last, because root canal lasts you the rest of your life, but if you don't take, oh, I don't really believe in that. A root canal, like if your crown is bad, your root canal is bad. So it may not be the root canal is bad, but if the tooth cracks in two pieces, it's not the root canal bad, but a lot of things can go wrong with that. But still a good procedure. I know that that's root canals redone. I don't really believe in there. Hi, you are late. Hi, Rehab. I normally see you every week, but I did not see you unless you've been here this whole time and just didn't say hi. Hello. But you can always watch it on the replay. And I was meaning to say, somebody was telling me, you should tell everybody that you're really good on 2X. I talk really fast, but if, yeah, you're late, but it's no big deal. You catch it on the replay. Catch it on the replay. No big deal. Oh, awesome. That's why you played the, I forgot what instrument already. Tuba? Tuba. Yes. Listen, the braces journey is a journey. That is something that is, people are always wondering about. Don't get mad at me, but orthodontists lie. They always tell people they're going to be in braces for 2 years and they're in the braces for 4. So you gotta be careful with that, because that's just what it is. But if you're a teenager, it's fine. The time is okay. When you're adult, you don't have the patience for it. You're like, aren't I supposed to be out of these things? And then somebody's like, no, you have another 6 months. And then I see you 6 months later and you still have the braces in your mouth. Somebody asked me something else. I think I missed a question. Feel free to re-ask the question if I missed. Elizabeth is going tomorrow to get brackets placed. That's actually, I thought I did it. I used to do something called fast braces. I no longer do it because it's time intensive and I just don't have the time for it. But in fast braces, I thought I made a video about me putting on brackets on someone, which is a very fun appointment. I love orthodontists because orthodontists don't do anything. If I would have went back to school, I would have been orthodontist. All they do is do the treatment planning and the assistants do everything. It's awesome. It's awesome. They're the brains of the operation. So basically, they come up. Clear brackets are awesome, but they do break. You got to be careful with clear brackets because they can break a little bit more often than the metal brackets, but they're more cosmetically pleasing. And you also have to make sure that you clean them often, because if you don't clean them often, they look dingy. So it's really important to take really good care. When I meet somebody who just got braces, whether or not I knew they were getting braces or not, I say after your first 6-month appointment, ask the hygienist how you're doing. And if you're not doing well and you're packing a lot of food and stuff like that, make sure that maybe you need to come every 3 months or every 4 months for cleaning, because it is a lot of work to keep all of the food out of those brackets and wires. You're gonna stay brushing your teeth all the time. And if you're not brushing your teeth on a regular basis, I'm just gonna tell you right now, you are committing a social crime, because watching someone eat that has braces and does not brush their teeth is not fun for the person who is viewing you. I used to have somebody who worked for me and she had braces, and when she ate, all of the food was in her teeth and she wouldn't take it out and it would look horrible. So make sure, remember, other people are looking at you. They're gonna see all that stuff kind of chunky formed in your mouth. So make sure you're one of those good people. You watch Dr. Denis's YouTube, you know all the good tips, and you take care of your mouth very well. All right, so I'm gonna start wrapping this up. I'm always shocked at how 15 minutes can go back. I'm like hiccuping again every time I drink water. I enjoyed this as usual. If anybody has any last questions, I have a moment before I have to go. Alrighty, so make sure if I didn't, and anybody watching this on the replay, if I didn't answer any of the questions that you wanted me to answer, make sure that you go ahead and put it in the comments below. Oh, modernsmilecs@gmail.com. And then, you know what? I was thinking, hi, you're late, or unless you were there the whole time. Thank you for, I don't know how to say your name. Oh, Elizabeth's gonna go play at the basketball game. The other one that's from Poland, I can't say your name, but thank you for giving me the shout out on Instagram and posting. That's okay. Thank you for giving me the shout out on Instagram. I just reposted your video. I don't know if you knew you were recording while I was on live. I do like that. That's appreciated. I think, thank you a lot for that. And Elizabeth, good luck on your basketball game. I'm probably doing the wrong instrument. I hope you guys have a wonderful day. I appreciate you so much. Don't forget to comment down below. I do see that I need to do better at commenting. You're welcome. Thank you so much. I need to do better at looking at my old videos to get the questions, because I get really good questions from there, except that for some reason they don't pop up to me until much later. But make sure to check out. I'm going to do a new video on this week, which should be very interesting. And whoever was asking for the ASMR video, we're going to get 2 videos this week. One regular video. You felt like it was short? What? No? 52 minutes? Okay, Adir, I'm gonna put some contact information in here, so that if you guys ever want, I don't know why you want to send me something, but if you want to send me something, if you want me to review something, if you want me to look at something, I'll put it down there, and I'll put my email address in the description box below, so you can send me something. Make sure if you follow me on Instagram, awesome. If you follow me on Instagram at Modern Smile CS, it's more locally driven because it's my people who live in Coral Springs and stuff like that. But you can DM me. I try to respond to as many DMs as possible. So you can DM me. I don't really like it because it's harder for me to notice, but I do check my email on a regular basis. So you send me all that stuff and it'll be good. Alrighty, bye everybody. This is my little dance at the end. Bye everybody. Have a wonderful and blessed day. Bye. You know, I like to do, sorry, before I go, I usually like to do the scroll of the shout out list of everybody's name. Bye Elizabeth. Bye Adir. Bye Gal for God. See ya. You know, I like to give my little thing, but because I'm not on the computer, I can't say everybody's name. Bye Mitch. Bye Mitham. Did I miss a name? Bye Maurice. Bye Maurice. Good luck, Elizabeth, with your game, and good luck with everything. Bye everybody. Have a wonderful day. Make sure you share with your friends. Bye.